If you're dealing with a herniated disc, sciatica, or back pain shooting into your leg, and nobody has really explained what is actually going on yet, stick with me for the next few minutes. I'm Dr. Chris Cox with Life Align Wellness Center here in Tucson, Arizona. I've been helping people with chronic back pain, disc injuries, nerve pain, and sciatica for over 25 years. In full disclosure, I've personally dealt with ruptured discs myself. So I'm not just speaking from theory. I know exactly what it feels like to wake up stiff, brace yourself just to put your shoes on, and wonder if there is ever actually going to get better. So let me walk you through what is actually happening, and more importantly, what actually helps. Think of them like shock absorbers. They have a tougher outer layer and a softer gel-like center. A herniated disc happens when part of that inner material pushes through a weak spot. If it presses on a nerve, that's when you start getting symptoms like shooting pain, burning, tingling, numbness, or weakness running into the leg or arm. But here's what most people never get told. This is not just a mechanical problem. When the spine and nervous system stop functioning correctly, the muscles, joints, ligaments, and stabilizers around that area stop coordinating the way they're supposed to. And that's when things start spiraling. Also, important myth to clear up, just because your MRI shows a disc bulge or herniation does not automatically mean that that is the source of your pain. Research shows a large percentage of pain-free people have disc bulges and never even know it. An MRI is just one piece of the puzzle, not the whole story. Here's the cycle I see all the time. Someone hurts their back, so naturally they stop moving. They sit more, they avoid activity, guard the area, and initially that feels safer. But over time, the spine gets stiffer. The stabilizing muscles weaken, the nervous system loses healthy movement input, and now the injured area is handling more stress with less support. That's why so many people feel temporarily better, then flare back up again. And it's not just physical stress. Your body processes stress three ways: physical stress, chemical and inflammatory stress, and mental or emotional stress. When all three stack together, your recovery capacity drops. That's when a small disc issue turns into a chronic problem. That's also why quick fixes often fail. At our office, we're not just chasing symptoms. We're focused on restoring function, improving nervous system control, building stability, and helping your body actually recover the right way. Before decompression, before exercises, we need to know exactly what we're dealing with. Because not all leg pain is a disc problem. Sometimes it's the SI joint, piriformis syndrome, hip dysfunction, spinal stenosis, or something completely different. So step one is getting the right diagnosis. We start with one-on-one consultation and a detailed exam. We go through when it started, what aggravates it, what helps, what you're already trying, and what your goals are. Then we look at how your nervous system is functioning. Reflexes, strength, sensation, movement patterns, orthopedic testing, sometimes imaging if needed. We're not just looking for where it hurts. We're trying to identify why it's happening. If you're having loss of bowel or bladder control, numbness in the groin or saddle area, or rapidly worsening leg weakness, that's a medical emergency. Go to the ER immediately. That can indicate something called cauda equina syndrome. Your safety always comes first. And if we are not the right fit for your case, I'll tell you directly. Once we understand what's going on, we build a customized plan around you, not a cookie-cutter protocol. Phase one is calming things down, reducing irritation, improving motion, taking pressure off the nerve. That may involve gentle chiropractic adjustments, spinal decompression, movement strategies, and positional changes. No aggressive twisting, no unnecessary force. Then we move into restoring proper movement patterns. Because the spine works as a system, if the hips are restricted or the mid-back is stiff, the lower back usually pays for it. Then comes the rebuilding phase. This is where most people fail if they try to do this on their own. Core stability, glutes, hip stabilizers, movement control. That's the difference between temporary relief and long-term change. And eventually, the goal is to return to life, not just sitting at a desk without pain. I'm talking about hiking, traveling, working out, playing pickleball, picking up your grandkids, sleeping through the night again, living normally. That's the real goal. We recently had a patient in his 40s, warehouse worker, severe low back pain and right leg pain after lifting. By the time he got here, he couldn't sit for more than 15 minutes, wasn't sleeping, and had completely stopped playing basketball. We confirmed disc involvement during the exam, starting with gentle care and decompression, then gradually rebuilt stability and strength. Within a few weeks, leg pain was dramatically reduced. By around 2 months, he was back to work, sleeping normally, and back on the basketball court. That's what can happen when the diagnosis is accurate, the plan is structured correctly, and the patient commits to the process. We also use additional therapies when appropriate. Spinal decompression can help reduce pressure on irritated discs and nerves. Shockwave therapy helps stimulate healing in stubborn, tough, soft tissue and muscle patterns around the spine. But I want to be very clear about something. We do not stack therapies just to stack therapies. If something is not appropriate for your case, we leave it out. And if you need a surgical consult, pain management, or another specialist, I'll tell you that honestly too. Our job is simple: get you the right care. If this sounds like what you've been dealing with, don't wait until it becomes a bigger problem. At Life Align Wellness Center here in Tucson, we offer consultations to help determine exactly what's going on and whether we're the right fit for your case. We also created a free herniated disc recovery guide, including what to do early on, positions to avoid, and warning signs to watch for. You can download that below, or call our office at 520-731-9595. Let's help you feel better, move better, and live better.